Redefining MedTech shares the stories of clinicians, executives, inventors, entrepreneurs, and researchers who are transforming healthcare through the development of medical technology. Through our in-depth interviews, digital health leaders will share their journeys, offering you insights into cutting-edge technologies and how to integrate them into your practice. This is Redefining MedTech. Welcome to Redefining MedTech. I'm so thrilled to welcome Dr. Vik Bakhru, a physician, a senior health executive, a serial entrepreneur with extensive experience in technology. So thank you so much for joining us today.
Thank you for having me.
So you have your MD, you have your M.B.A, you still practice, and you have this vast interest in medical technology. So let's kind of rewind a little bit, and if you can share with us a little bit about your education and what sparked your interest in both medicine and then moving on into the world of medtech.
Sure, absolutely. I grew up in upstate New York, and a very rural part of our country, and found my way to D.C., where I went to medical school, and after that, Philadelphia for residency. And for the various phases of my career and my education, I realized a few things, one of which is when you get too much education, it's time to go and actually spend more time in the real world. And so I would say that the last 10 years or so of being able to work in at the intersection of health and technology has been the most valuable I think I could possibly imagined having in terms of work experience. So it's been great so far. And the interest stemmed from struggling with acne and other health issues as a child, and then many family members experiencing the healthcare system in different ways, whether as a caretaker or as a patient themselves. So the interest in finding ways to improve how people access care and make use of the tools that are available to them through technology and innovating has probably driven a lot of my interest today.
So what led you to develop your company that you just recently sold?
Oh, sure.
That was in telemedicine.
Sure. The telemedicine company was really about finding a new way to interact with patients and get them access to care when it's hard to make your way into a doctor's office or hard to wait for several hours in an ER. And so the concept was take messaging, which has grown to be the top way that most people communicate with each other these days, and apply that to the healthcare realm. So how could we develop an opportunity for people to just ask a quick question, just get some guidance on, is this real? Do I need to go in and have it taken care of? And so that was originally what the concept was. And I joined the company after my partners had started the side of it that allowed people to do the messaging, and we added on additional services, being able to have a video chat with the doctor and have them be able to see into your house and understand what else is going on. Are you on multiple medications and some bottles are in the kitchen and others are in the bathroom, and are you forgetting to take one or the other? And how do patterns of daily living affect your health?
So it's improving compliance with what the doctors were.
Absolutely. And often the best way to improve compliance and adherence is to focus on education and surveying what does the patient understand or not understand, because most people understand taking a medication is important, but it's the why that really drives behavior and behavioral change in particular.
Did you find it initially difficult to transition from that physician world into the world of a venture-backed technology and dealing with the dynamics that are involved?
Sure. I would say for me the transition was a little bit easier because I ended up going to business school and found myself surrounded by very creative, very innovative people who just thought differently than I was trained to think in medicine. And so
what point in time did you go to business school? After you were already involved?
After residency,
okay.
yeah. So this was
right after. Okay.
This is exactly right after, and then I worked in hospital administration for a bit, and never thought I could sit at a desk and interact with people in an office environment. I really thought that I had to be on my feet and moving about and so forth, and I still am more than I thought I would be. But no, this world has been fantastic and allowed me to have impact in a very scalable way. So whereas previously I might interact with one patient at a time, here I'm able to build technology with a software team and impact thousands and tens of thousands of people at once with that same technology. So that's probably been the most exciting part of the journey.
So fast forward to now, and you're Chief Operating Officer of ConsejoSano.
Yep.
So what is this organization?
Sure. ConsejoSano is a multicultural patient engagement platform. So we build software that allows health insurance companies and doctors' offices to communicate with their patients in a very culturally sensitive way. We believe that patient engagement 1.0 was about making sure you had the translation of the message into the right language for the patient, and we believe that patient engagement 2.0 is really about using culture and the way that a patient lives their daily life, their attitudes, their beliefs, their traditions in their household. How does all of that come together to inform what they do on a daily basis? So it's not just about translating a message like we used to. It's about making sure that, yes, you're communicating in the language of preference, but that you're also taking into account all the other attributes that make a patient do what they want to do on a daily basis.
ConsejoSano is a multicultural healthcare technology platform. So what does that mean? I know that your tagline, right, is America is multicultural, but healthcare isn't. So take us through exactly like what the process is and what exactly they're measuring and the data that you're able to retrieve from the patients and just what the benefits are, not just to the patient, obviously, but the information that the provider is receiving.
Absolutely. A great question in terms of so much that goes into defining culture and being able to serve it effectively. And so when we think about patient engagement, it's all about building trust, building relationship with that patient. And if we think about healthcare today, most doctors' offices and health insurance companies have a relatively singular message. They put out to the world, come in for an appointment. But come in for an appointment in many different cultures means many different things. And so we really have to take a step back and understand, what are the patient's needs? What are their beliefs? How do we bring all of that understanding in a data-driven way to be able to then turn back the right message, the right language, the right information that should be included, so that when I'm talking to perhaps a deferential patient from an Asian background who might be one of the 2% of Asian residents in Florida living in a isolated state because there are a predominance of other cultures, how do you talk to that person versus maybe an Asian resident in a big city where they're surrounded by other Asian people and feel more at home, feel more comfortable in their neighborhood? And so there's a difference in context there that we have to consider. And healthcare today doesn't do that. It's a very, sort of singular approach. So ConsejoSano builds technology that at a zip code level understands those variations, understands the daily lives of the people in those communities, and understands the resource levels. Social determinants of health is a big area of focus for us, and we try to understand what's their access to transportation to get to the healthcare facility, what's their access to food security, income security, housing security. Are the people we're talking to possibly going to lose their home and therefore end up in the ER a multitude of times over the next 12 months? How do we prevent some of that, right? We talk about preventative health, but let's talk about preventative circumstances. And so how can we intervene, and how can a health insurance company or a doctor's office be a part of that equation? They really haven't in the past. And with 60 or 70% of health outcomes determined by social determinants, we have to do better, right? We have to do better to understand what they are and to address them. So our technology platform does a lot of this and makes it seamless and builds trust and relationships with people who really need the help.
So you lived in Central America and worked as an entrepreneur in healthcare services domain for a nonprofit that you personally founded. Can you speak to that?
Sure. This is a nonprofit that I started while I was in medical school. It's called Foundation for International Medical Relief of Children. We build and operate pediatric clinics in the developing world. So we started our first clinic in Central America, in Costa Rica. This was in the 2003-2004 timeframe. And in the very early days of the nonprofit, it was intended to be a very local effort where, similar to Habitat for Humanity and other charitable causes, a group of young folks were coming together to try to have some impact in the world. And we did, and it grew from one clinic to 2 to 3, and now we're in 10 countries with about 3,000 staff worldwide, and I couldn't be more proud of the team and the work that they're doing. It has been a phenomenal experience, and leading up to, we got a little bit of founder syndrome where, I had worked so closely with everything that it was time to take a step back and let someone else run things. Yes, exactly right. And it was a hard process for me personally to go through, to let go. But that learning and that journey has taught me so much about interacting with people and capable people. And so I can't comment enough on the entrepreneurial side of things about how important it is to make sure that you're, leaving room for others to breathe. And the woman who ended up taking over for me, a woman by the name of Meredith Mick, 8-9 years later is still our CEO and is doing a fantastic job, sort of leading the effort. So I think we've been sustainable largely because of her contributions in recent days.
That's phenomenal, and congratulations with all of that. So do you attribute your time living in Central America? Do you attribute that time to give you the sensitivity to want to do the current technology that you're doing?
Absolutely, yeah. Especially given that the foundation was focused originally on Hispanic and Latino culture and people. For me personally, I learned Spanish in middle school, and it has stayed with me through the various phases of my own journey. So in medical school, I had the chance to participate in a program where I was serving as a translator for a patient in a neighborhood of D.C., and the Operation Smile is the name of the organization that I had volunteered with. And so I had a chance to use that there, and then obviously when I lived in Central America, preparing to hand off the foundation to Meredith, it was a chance to just fully explore the culture and immerse myself in it. And it was that immersion that has ultimately, I think, led to my interest in continuing to serve people in the United States now who identify as Hispanic or Latino. Most of ConsejoSano's work is with lower income, underprivileged individuals, and when we look at the landscape, we focus on Medicaid in particular, also Medicare, but in the case of Medicaid, we have about 74 million people in this country on Medicaid and 1 in 2 children. And so when you look at then the cultural breakdown of that population, out of those 74 million, about 60% identify as non-white. And so it's a very diverse group. And so we have to change our approach in healthcare to be focused on serving diverse populations. And if we don't, we will continue to see worse health outcomes in those communities, not only because of poorer access to resources, but because we're not able to engage and build trust and help them actually take care of the needs that they have for themselves and their families.
Now, is this fully rolled out?
Yeah, ConsejoSano is operating right now. We operate in 7 states, and we started in California and do a lot of work with health plans and with doctors' offices to provide that connection to the patient.
Do they opt into this, or does the practice opt into this? How is the...
Sure. So our company focuses on building programs for health plans and doctors' offices to reach out to their entire population with a focus on improving quality measures. So we really want to make sure that what we're doing is ultimately going to have the impact that we think focusing on culture can have. So when we work with a client, when we work with a health plan or a doctor's office, we are typically surveying them on which of their quality measures are not being addressed, and then we build programs around that to engage patients largely through messaging. Given my own background in messaging and given the familiarity of people with being able to access their smartphone and use messaging without having to download an app and remember a password and go through all the hoops of logging in to a website or what have you, this is just a native functionality. So whether through SMS or through live outbound calling, no robocalls, we only do people talking to people. We believe strongly in that. And mailers and email if necessary, because there are some regulatory considerations that we have to make sure we're being sensitive to. We can't send people texts if they don't want to receive texts. We have to make sure that we're staying true to our belief that the way you build trust is to communicate with people, to meet them where they are, and to communicate with them how they want to be communicated with.
And at the end of the day, who are they communicating with?
Mm-hmm. So typically ConsejoSano works on behalf of the plan or the doctor's office so that the patient feels the connection to those entities. So when we're working for a health plan, the patient understands that they're talking to the health plan. And on the back end, we're making sure that what the patient tells us is communicated back to the health plan so that they can fix the problems. Did you lose your insurance card? Okay, well, let's help you get you a new one. Did you want to get in for an appointment? Okay, well, we can actually go into that scheduling system and schedule it for you. Our agents, right, act on behalf of the clients we serve.
And when you're dealing with the provider, so the provider themselves, are they able to bill for that, or how does that work?
Sure. So typically, because we're focused on quality outcomes, most of the opportunity for providers and health plans collectively is to improve the health of their population. And that, in turn, allows them to keep serving the patients that they want to serve, because typically these are lives, Medicaid lives in particular, are typically assigned by the state to a health plan or to a provider group. And so being able to help them effectively serve that population lets them keep doing what they're doing, because if they don't, they typically will, through an RFP process, lose the opportunity to serve those patients. They'll lose that book of business from the state, if that makes sense.
It does make sense. So what gets you up in the morning? Is it the drive to continue what you're doing with your technology and conceptualize potentially a new way to do things, or is it the convergence of how medicine plays into your role as a serial entrepreneur in technology, or is it the altruistic physician that just wants to go and serve people and help people?
Well, those are very lofty considerations. I would say at the end of the day, it's the people. It's the opportunity to serve people who actually need help and aren't getting the care that they deserve. I believe healthcare is a right. And it's also the people I work with. We have an incredible team. And it is just fun to go to work. And I think that's when you've found the right job, is when you're able to go to work and not make it feel like work.
So you mentioned team. Let's talk about how you built your team, both
Sure.
in your previous success and ConsejoSano now.
Sure.
I think it's so important to have people around you that are smarter and wiser.
Absolutely.
So how did you go about doing that?
Sure. Building a team is, I think, one of the most exciting things you can possibly be privileged to do. So when you think about recruitment and finding the right folks for your team, sometimes they find you. And so sort of keeping a very positive energy and an open mind to people that you come into contact with at conferences or in other forums, I think is always a great way to hopefully attract people to your mission and to your cause. LinkedIn, some of the standard tools that are out there are also very effective. If you can create a posting that speaks to people, right? If you can create a job posting that conveys that energy and that enthusiasm that you might have about your business, that comes through, even in the written word, certainly during the interview process. But I think, the approaches you take to recruitment and to building a team, at the end of the day, you want to find a good group of people that work well together. You want to find a group of people who are committed to the cause more than the salary, because in the startup world, it's not about the salary. It really isn't about the money, and especially in the early days when you're still raising funding and trying to convince investors that there's a real business here that they should invest in because they'll realize a return and so forth, right? And then in the case of ConsejoSano, we were so incredibly fortunate to gain the support of social impact investors. So companies like Acumen and Impact Engine and Total Impact Capital. These are companies that believe in the cause.
Right.
That's exactly right.
Naveen Jain was here earlier, and he talked about by doing good you do well. So.
Absolutely, couldn't agree with that more.
Right. So can you discuss what difficulties and challenges you might have faced, over the course of your technology entrepreneurial time?
Sure. Everything from software bugs that you just have to stomp out when they come up to the uncertainty of running a business. When you're a new business, it's very difficult to convince institutions that have been around for a long time, health plans and large doctors groups, and other entities that you might be trying to gain support from. It's very hard to convince them that what you're doing is proven, that what you're doing is real enough, that what you're doing can support their needs. I mean, they're thinking in hundreds of thousands of patients, and my software might only be able to work for a few thousand before it crashes. So building into that process some level of salesmanship so that you're able to convey that I've got something real, here's why, and here's the journey we can hopefully go on together. With your support, we can build this and realize X, Y, and Z outcomes, and hold me to that, right? So you contract around those outcomes, and you contract around some of those opportunities even.
What do you attribute to your professional success?
Oh my. In the early days, it was just a lack of sleep. It was pure, pure effort. Even with the foundation, you know, our first year of revenue was $24,000, and we made that mostly by serving concessions at a concession stand at what was then MCI Center in DC. And so literally a group of 10 of us would just go and sell hot dogs and candy, and we would get 10% of whatever we sold. It was a program through Aramark. And then eventually we, you know, sort of developed a different pathway. But yeah, it was, you know, truly I would say success is mostly determined by, I believe, you know, how hard you're willing to work for something because you believe in it, coupled with great mentors and people who are willing to, you know, sort of give you their time. I think that's, you know, probably the most important thing anyone can give you is, you know, their time, so you can understand what has been their experience, and, you know, how can you learn from that? How can you sort of take those pearls of wisdom and incorporate it into what you're doing?
Just from this chair, listening to you, though, it seems to me that you've taken things that you have a sensitivity towards and want to, you know, make a difference in, and built businesses in order to be able to do that. So I think that might...
Well, it's very kind of you to say, and I appreciate that. I would say that a lot of that probably has to do with my upbringing, and my grandmother in particular.
Can you share?
She was, you know, she grew up in a time when most women didn't go to school in India, and she grew up in a time where there was a lot of civil rights activity going on. She volunteered for Gandhi, and she did a lot of sort of social justice type work. She was a teacher by training, and just hearing her stories growing up, I think really inspired me to want to make sure that I'm always including an element of giving back in whatever I do. For sure, you know, that was part of the driving force behind medicine, aside from my dad. You know, you know, in Indian culture, you really have one of three choices: engineering, medicine, or law. If you're going to go on, you know, to school, to graduate school.
So how did you make that choice?
Well, you know, it was again a combination of personal health circumstances and certainly, you know, some influence of my parents for sure. I can't deny that.
So is there anything or any route or anything you would have done differently along the way?
Oh my, how much time do you have? You're not supposed to say you have any regrets, right? And I don't. I'm so blessed and so incredibly honored to have gone the path that I did. I wish I could look back and say it was planned. Every single thing I did was something I magically foresaw. Ordained, right? No, it absolutely wasn't. I tripped and fell at every juncture. I mean, there were mistakes made. There were...
So what have you learned from those mistakes?
How to get back up. Absolutely. I mean, you go through, you know, you fail a test, or you know, don't meet a deadline, or, you know, depending on the context, whether it's, you know, in school or in work, you disappoint people along the way. You make mistakes in team leadership, you know, and so I think for me, you know, collectively, just, you know, reflecting and having the awareness of those and having great people around you to point those failures out and help you see where you went wrong. Even today, you know, it's been a journey, and I feel so blessed to still be going on it. You know, I've got a long way ahead of me before I'm going to stop doing what I'm doing.
So of these challenges that you faced along the way, what do you think has been the most important lesson that you learned?
I think the most important lesson is never give up. Persistence is the greatest determinant of success. You know, I forget which TED Talk it was, but I saw one of these videos where the speaker was referencing how timing was found to be the most important factor in whether a startup makes it or not. And I think that's probably true. I accept that, you know, as possibly an important factor. But I think persistence is probably the next factor, because you hear about all these celebrities who were told, no, you know, you can't be an actor and you're never going to make it, you know, as a singer or what have you. And then you hear their stories about how it was because I didn't give up. And I would say the same is true in business. The same is true in medicine. We don't give up on patients. When you have a diabetic sitting in front of you who's not willing to change their diet, you don't walk away and give up on that person. You build trust, and you keep trying, and you keep approaching, and you have to change your approach, which is, you know, what healthcare needs to learn how to do better. In business, you know, if 10 people tell you, no, it's a terrible idea. Okay, well, learn from that. Take in those pearls of wisdom from others' experiences, but don't give up on your business. Don't give up on your mission, especially if your mission is to help people, like I think ConsejoSano does, which, are lower-income households and vulnerable populations. I mean, you can't give up on that, right? So I would say persistence and not giving up is probably the most important thing I've taken away.
So being that this is a MedTech podcast and the community that will be listening and to your words of wisdom. So if you have the physician who is, deep down is hoping to bring out that entrepreneurial spirit, and he's got a great idea, or at least something that he thinks is a great idea, what golden nugget could you pass along for that?
Well, first of all, I hope it's a she.
Well, me too. I was just going to say that, actually.
I believe so strongly in that right now.
Thank you for saying that.
No, I mean it sincerely. I would say commit to trying something different. And start small. You don't have to have these grand, ambitious plans that are going to change the entire industry overnight. That's not how change happens. And for me, it was very much a stepwise function. It was stay the same, doing the same thing for a while, and then find something new, and then stay the same for a while and find something new. And so, it's very much build as you go, very incremental. And so take the small steps in your own practice, if you're practicing, and find those opportunities to incorporate new and innovative tools. Talk to people, go to conferences like this one, find ways to really understand what's out there already, and then incorporate that into your daily practice. And gradually, it's always going to be about people, right? Progress in society happens because of the people of the moment, and so the people that you encounter at that moment. And so for me, I think I would recommend that you get out there, talk to people, attend conferences, network, pick up the phone, reach out on LinkedIn, just connect with people and learn from those different experiences. They'll tell you their failures usually, right? If you if you ask the right questions, you can understand what you shouldn't do, so that we don't reinvent the wheel. But in your everyday practice, find ways to think differently than maybe we have in the past. I had a friend. Do we have time for another anecdote?
Yes, of course.
I had a friend who was facing difficulty in their own practice in terms of calling patients to remind them about their appointments. And so I, very candidly said to them, "How come you don't call your patients to remind them that their appointment is tomorrow?" And the response I got from her was, "I can't sit and call 22 patients." And I said, "But can you send them a text? How else can you reach out to them that might be easier for you to do? Can you record a message and use a tool to have that message delivered to that patient by text or by calling them? How can you be creative, right? If this is the problem you're facing, what steps have you taken to try to solve it?"
The technology's out there.
The technology's there. We have it today, right? This is actually, a lot of where I spend my time trying to work with clinicians to reformat what they think is part of healthcare, right? The loose rug that's in the hallway that grandma's going to trip on next week, that is my job.
Forget about grandma.
That we're all going to trip on, right? Exactly, right? And I mean, these are truly aspects of healthcare that we have to understand are part of healthcare and that are the clinician's job to address.
Well, thank you so much for your time, Dr. Bahkru.
My pleasure.
Congratulations on your successes.
Oh, thank you very much. And thank you again for this opportunity.
Absolutely.
This is Redefining MedTech.